Hey, it's Dan. I thought I would make a video on my progress with carpal tunnel release surgery and the ulnar nerve surgery. After my surgery, and especially after 2 weeks of recovery and the slowness of that, I looked up some videos on YouTube just to see, if I was normal or abnormal. I didn't feel like I was progressing very quickly, and I would have liked to have made my recovery to have been a little shorter, and so I was looking for other people's testimony, and I found some good things there. It encouraged me to realize that a lot of people have difficult time recovering. It's slow. I remember my doctor prior to surgery telling me that it was pretty rough recovery if you have both of those done. So carpal tunnel release and the ulnar nerve, especially if you have a pretty severe case of each one of those, which I did. He was trying to tell me that the recovery was difficult. In fact, I looked at the expression on his face, and I remember it now, but at the time I was thinking, well, I just want to be getting better. And so whatever I have to do, I want to go ahead and get with it, and so that I can recover. Well, I've learned to regret those words. I don't think I fully understand. I should have asked more questions. I should have thought about it maybe a little more. Now, I probably would have still done the surgery, but it would have helped me realize just how difficult the recovery was going to be. So let's talk about that a little bit. So I went in for the surgery. I thought the surgery itself was pretty easy. I mean, they put you to sleep. You wake up and it's done. You don't feel anything. Your arm is in a little bit of a soft cast with some support there, some splints. And so mine was in that wrapping and splint with a sling for 2 weeks. Now, I didn't wear the sling all the time, but I did at times just to help support my arm. And so for 2 weeks, I was in that soft cast, and it's a pretty difficult time. They give you some heavy meds to be able to sleep a little bit. I would recommend using them early, very well. And looking back, if you can take 2 weeks off from work, that's a real good idea, or at least a week to take off from work. I didn't do that. I kind of continued with my normal duties, but I'm a teacher and a pastor, so it wasn't that hard for me. I could do without my left arm pretty well. I wasn't able to type or anything like that. But the reason I say it's good to take the time off is you just don't feel great. Your arm hurts when the drugs wear off your arm and your wrist, and it's going to hurt a little bit. And it didn't seem to me that Advil helped a whole lot. The heavier drugs help in terms of sleeping and that sort of thing, but you don't want to be groggy all the time during the day. So I'm just saying this, if my advice would be that if you can take 2 weeks off from work, or at least a week, that's a real good idea, because you're just not going to feel that great. And it's just hard to eat and clean yourself up and get dressed and all that. Everything's just harder, with your arm the way it is. So taking showers, you have to bag your arm and then be very careful not to get it wet. And it's just difficult. It's just difficult. Just daily living is difficult enough aside from working. So that would be my advice. And later on, I've got to have my right side done. And I do plan to be out of commission for a week or so at least, just to make things a little bit better. Anyway, so the surgery went pretty well. Came home. That's kind of how my first 2 weeks went, with the cast on my arm, the soft cast and all. You've got to be really careful, because I think you can even press on your nerve even with that cast on. So be careful where you lay your arm and the position and that sort of thing. I think having some covers to lay your arm on, or even some very soft pillows in terms of elevating that sort of thing, is very important. I also would check with the nurses and the doctors to make sure that it's not wrapped too tight as well. I kind of felt like mine was. My fingers turned blue and everything, and I'm not sure even how to, to determine whether it's too tight or if that's just the way it is. Your fingers probably do get numb and turn blue regardless, but I kind of felt like mine was too tight, though I didn't do anything about it. Anyway, so I had mine done on the 8th of a month, and then I went in on the 20th, which I guess is only 12 days. It wasn't exactly 2 weeks. So 12 days, and got the cast off and the stitches out. Man, my wrist was super sore and stiff and swollen. It was great to get that cast off, though. It was great to be able to take a shower without having to worry about getting it wet. But so here I am. I had mine done on the 8th, and it's already the next month, and on the 15th. So do the math on that. That's what? It's about 22. It's 22 days plus 15, so 37. So real close to, well, that's about 5 weeks, isn't it? Yeah, 5 weeks. So about 5 weeks of after surgery. And so I still have pain in my hand and in my arm. Now, where they did the carpal tunnel release, I'm going to show you my hand. So that doesn't look bad, does it? The surgeon did a tremendous job, and my hand is really healed up super well. So the carpal tunnel, affects your thumb and your pointer finger and your bird finger. Those fingers feel great. I don't have any tingling or numbness there, so I think the carpal tunnel surgery went really well. And on the elbow, I'll show you the elbow as well. So that doesn't look bad either, man. My surgeon's amazing. So that scar is healing up all pretty well. And look, even at my elbow, it's not really that swollen or anything like that. The problem for me is that my pinky and my ring finger, super numb and tingly, and even my hand, like the left side of my hand, like closest to my finger here, that part of my hand right there, and in my wrist is swollen still and bruised and stiff, and so it's hard to move and it hurts, and nothing really takes the pain away. It's been difficult. It's difficult to sleep. It's difficult to do anything. It seems like it's worse than it was before I had the surgery. Now, so I've been back to the doctor twice to talk about this and for him to look at it. And from what I hear, this is par for the course. This is just the way it is. So some people feel better right away. Some people take a month, 2 months, some people 3 months. So I asked my doctor, okay, I realize everybody's different, but I said, what's the average? What the average person, how long does it take them to feel a lot better? And he said, it could be 3 months, it could be 6 months, it could be 18 months. So that nerve could take a really long time to heal. So the reason I have numbness and tingling and soreness and swelling is just that the nerve was already damaged, and the surgery is just rough on that part of your body, and it's just going to take a while for all that to heal up. And so here I am 5 weeks out, and I really hoped by now to be feeling a whole lot better, and I'm just not, so I look better. I look like I'm fine. People want to grab me by the arm and that sort of thing, and they don't realize that I'm in pain and things are difficult. So I'm able to do a little bit more with my hand. I mean, if I'm careful, I can open a door. I can carry some really light things, but all in all, it's very difficult to carry things and to depend on my left hand and left arm. And so I just thought I would encourage you with these words, just to say, if you've had the surgery and it's been 4 weeks or 5 weeks or 6 weeks or whatever, realize that people that I have seen and heard that have had the surgery, it takes a while to feel better. So I'm hoping every day, to get a little bit better, and I'm looking forward to the day when things click in my arm and those fingers aren't numb or sore anymore, and that I'm a lot better. I've heard other people say that, that it hurt for a really long time and then things were a lot better. And so I'm looking forward to that, things being a whole lot better. Anyway, so feel free to holler at me. Let me know how you did. If you're watching this and you have the surgery, I'd love to hear how you're doing and how things went, and even like when you felt a whole lot better. So like I said, I'm 5 weeks out. I don't feel I don't feel better yet. I look better. The wounds are healing up, but man, I'm still roughing it out every single day, like pain every single day. So I do go see the doctor again in another 4.5 weeks or so, and I'm hoping at that time that I'm just so much better, and I'll try to report. I'm going to let you know. If you'll follow along here, you check back with me, I'm going to let you know. I'll post another video and let you know my time frame when I feel a lot better and how things go. And I hope I can do that soon. And I'll be honest with you. On my rougher days, I'm a little scared that it's just never going to be better. I would hate to be stuck at this level of pain and this level of difficulty. What a horrible thing that would be. Really do sympathize for people that are living with daily pain. All right, you guys take care. Hang in there. Hope you're doing well.